Thank you.
Okay, hi everyone. It's 10 o'clock, so we will get started, and then anyone who kind of straggles in can join us when they can join the call. But today we're going to talk about the coronavirus outbreak, mostly within the health and safety within the shelter context. I'm not sure how many of you are working in a shelter context right now, but either you can send us a chat if you're in a different area, and we can try to tailor some of the questions and scenarios to you as well. But for the majority of this presentation, we'll be focused on the shelter setting. So my name's Haley Moore. I'm a registered nurse in Calgary that's worked in harm reduction for the past like 13 or 14 years, doing mostly with sexual health and vulnerable populations and drug use. Honestly, I never thought within harm reduction I would be focusing on major pandemic, but I guess we're just rolling with the punches here. And then my colleague, Rachel Edwards, which I'll let her introduce herself as well.
Yeah, so I'm Rachel. I'm also a registered nurse. I've worked exclusively with vulnerable populations in shelter setting, in community health, and in sort of PSH kind of settings, always with people who are using substances and are experiencing homelessness. So yeah, again, working on a pandemic was not really the thing that I thought I would be doing, but here we are. So we'll get started. We do have everybody on mute, so bear with us as this is our first time using this platform to sort of deliver a program like this. Thanks, Corona. We much prefer to do this in person, obviously. That's sort of our best.
We'll probably be better in person.
Yeah, we're much better in person. And also, if I am involved, likely there will be a technology deficit at some point, so please keep that in mind. We do have everybody on mute, so if you can access that chat channel or that chat thingy, the question and answer period, feel free just to, as we're going through this, jot down your questions as you have them, and we will get to them at the end. And if we don't get to your questions today, we will have another session where we just address questions and answers. So to get started, we just want to acknowledge our partners in this. So Street Cred has secured funding through the Calgary Foundation for us to provide education like this. Ideally, we wanted to do all of this in person, and then here we are, pandemic. And so we are trying this new platform. So we want to thank Street Cred and the Calgary Foundation sincerely for allowing us to be able to sort of broadcast these types of education sessions to all of you, and to really just to be a resource for you guys throughout this as we all learn kind of what's going on in the world right now, which seems a little bit scary. So first, we are going to acknowledge that we like to do these land acknowledgements, of course, every time we start. So we would like to begin by acknowledging that the land upon which we gather today is Indigenous land. We also recognize that the traditional Blackfoot name of this place where the Bow River meets the Elbow River is Mohkinstsis, which is what we now call the city of Calgary. We would like to acknowledge that we are on the traditional land of the Blackfoot Confederacy, which consists of the Siksika, Kainai, Piikani, as well as the Treaty 7 territory, which includes Tsuut'ina and Stoney Nakoda, which is then comprised of 3 bands of Chiniki, Bearspaw, and Wesley. Calgary is also home to the Métis people of Region 3.
We also like to acknowledge, before we start any presentation, that this is a safe space. And even though we're doing this virtually and on a different platform than we would normally do, I just want everyone to respect that right now, everyone has some kind of fear right now. This is a pandemic that we're learning about in real time. So things are constantly changing, policies are constantly adapting, procedures are changing, and information is coming out daily that is new. So just respecting that everyone has a little bit of anxiety surrounding what is going on, and this is a safe place. And also just respecting that any question is okay. So we understand that there's lots of fear of the unknown. There's a lot of anxiety right now, and that's okay. So we're here to have those conversations and try to reduce some of that anxiety with the best practices that are out right now.
and also acknowledging that change in itself can be a bit scary. And so when we're having these sort of evolving situations, trying to keep on top of the newest information is challenging, and it also can create some anxiety. So that is sort of the purpose of this. We thought we could bring this venue to get everybody sort of on the same page about what is happening across Canada right now, and how best to respond to protect ourselves and the clients that we work with, but also recognizing that this is evolving so quickly that, you know, from shift to shift, there may be changes in your practice. And so really just normalizing that we are all in this together, and we will do the very best we can to provide the most up-to-date and current practice, and then again be that resource to ask questions of.
Okay, so what are we doing today? We're going to talk about COVID. That is why we're here.
So that's what we do every day.
But we're going to talk about kind of the basics, symptoms, safety. So some of that has evolved in the last couple of weeks or so. We're going to talk about personal protective equipment and what that looks like in your work environment. So also for yourself, for your clients, for your colleagues, and for your families when you get home. We're also going to talk about COVID-19 and how to respond properly to an overdose. And then we're going to do some scenarios and questions. The scenarios, we're kind of just going to run through some scenarios, but if you want to jump in on a chat through them, feel free. So there's a lot to discuss today, but we're going to do our best to not be boring, even though we're on the computer.
We should acknowledge that we are not practicing best practice, because you can see how close Haley and I are sitting right now. Not appropriate. Don't do this at home. Sure, I can do this. This is a lovely quote, and I actually really love this image. So what society judged was not the severity of the disease, but the social acceptability of the individuals affected with it. So we're going to discuss public health, the public health principles of social distancing, again, which Haley and I are not practicing right now. Bad.
We've been working together for the past month.
So we're cohorted anyways,
yeah.
It doesn't matter. And we're going to discuss how stigma and fear reduce adherence to testing. The availability of testing also affects testing. And talk about how, what? Oh, okay. I'm not saying that. Okay. And so sometimes that stigma can really drive how we approach something, and how we test for it, and our responses to it, right? So yeah, that's that.
Okay, so COVID. So what are we looking at here? So COVID is a large family of viruses found in mostly animals. In humans, they cause diseases ranging from the common cold to more severe diseases such as severe acute respiratory syndrome, or SARS, and the Middle East respiratory syndrome. So if we're looking at cases right now in Alberta, these were updated last night. So right now we have just under 1,900 cases in Alberta. The majority of them are in the Calgary zone. Still, we've had 48 deaths in Alberta. 35 people have been in the ICU, and we've had 115 hospitalizations since.
Emma's saying we're still on the first slide.
Is it not moving?
It's not moving.
Oh no.
Sorry folks, hang on one sec. Thanks, Emma. What do we do?
Yes, nothing is moving. Oh man. Okay, well then.
Somebody help us.
I don't know what we do. Okay, folks, bear with me for 1 minute. Has it updated? Oh. Yay!
Yay.
Okay. Oh no.
Now,
okay.
now it's moving on its own. There's a
sorry everyone.
In
Okay, so going back to what COVID is, if we're looking at these statistics, these were updated as of yesterday, but there was new information coming out yesterday that we have had more people recover from this virus than we have sick right now. So that is a really good landmark to look at, that over 50% of these individuals that have been infected with COVID or that have been tested and proven positive have recovered. So that's really wonderful news. But there's one thing I do want to just let everyone know the purpose of today is not to drill down into the science of COVID. It's also not to elicit any fear about this virus. So it's really important just to understand the basics of COVID-19 because that dictates our precautions and our practices and new policies that are developing. But we're really not here to give a science lesson. We'll leave that to the virologists and microbiologists.
Yeah, there's people a lot smarter than us working on all of that. So we are going to talk more about the boots on the ground kind of a scenario.
Yes. But if we are looking at Canada, cases right now, we have about 26,000 cases. And in Calgary, we have just over 1,200 cases. So out of that 1,800, we are looking at that 66% mark. But one thing that I really want to mention is within Alberta, we are one of the highest testing areas in the world. So Australia is a little bit better than us, but that's about it. So we've tested just over 82,000 people for COVID, which is really phenomenal when you're looking at kind of worldwide practices. Now I just want to make sure, did my slide change? Yes. Okay. Thanks everyone. So just the basics of COVID, it usually spreads from close person-to-person contact through respiratory droplets. So such as coughing or sneezing. If you're a spit talker when you talk, it can transmit that way as well. It may also be transmitted through airborne transmission, but I want to be very clear on this airborne transmission. It is just with aerosolizing aspects. So that's if you're using high flow oxygen, if you're using a BVM, if you're using a face mask.
Bag valve mask.
Oh yes, bag valve mask.
Yeah,
Thank you.
Not nurses.
If you're using a face mask when you're performing like rescue breaths or CPR, and when I mean face mask, I mean the one that goes on your face that kind of suctions to it, not the kind of plastic sheet that just sits across. So that can cause airborne transmission, and that can leave the COVID virus in the air for up to 3 hours. So that is something that we will talk about throughout. But when I mention aerosolizing transmission, that is not just with general person-to-person contact. That is with specific medical behaviors that we're using specifically to increase respiratory drive or to help with an overdose.
An IPNC person explained this really nicely to me, is that it's actually a pretty big virus. And so when people are speaking moistly, the viruses that kind of come out when you cough or sneeze or are speaking are quite heavy. So they fall immediately. It's just when we're like sort of introducing that oxygen or that sort of high pressure where those droplets sort of disperse, yeah. So they become smaller, and so they disperse, and so they're not falling as quickly as they would otherwise. So I thought that was a kind of a neat explanation of it. So I just imagine these like little viruses spewing out of my mouth and falling immediately to the ground. So yeah, kind of gross.
I really liked your word choice there as well. Just taking a word out of Justin Trudeau's book. Hey, moistly. Good work.
Good work. It's a good one.
Also, this infection can only be diagnosed by a laboratory test. So it's either a nasopharyngeal swab or a nostril swab. So we do have 2 swabs here in Alberta. So if you're talking with someone and they just had like a little swab within the nostril, and then you went to go get tested and it felt like it was hitting your brain, that's okay. We have 2 different tests right now.
Is it okay though? Because one of them is significantly more uncomfortable.
Yeah, well, that is true. What one did you have?
I had a nostril
one.
Yeah, it also wasn't pleasant, but it didn't go up through my nostril and down to the back of my throat. So
that's fair.
That is nicer.
Okay, so if we are looking at symptoms,
negative, by the way, I should say that.
Nice work. High five. Okay, if we are looking at symptoms, they typically develop within the 14 days of exposure. So they can include a few things. So we're mostly looking at cough, sore throat, shortness of breath, fever, and muscle aches. But there have been new studies shown with a sudden loss of taste or smell, and that's been presented in a lot of other provinces. So a lot of the information that we are presenting today is Canada-wide. So some of them will differ just a little bit, but it is a Canada-wide precaution and symptoms that we're using.
So again, pausing just here for a moment, when we're thinking of these symptoms, and we're thinking of the population that we're working with specifically in shelters and those PSH buildings and housing programs, these are symptoms, especially that sort of muscle aches, the cough, the shortness of breath, that these things will sort of disproportionately affect those people that are vulnerable, living in shelters and that sort of thing. So we really want to be clear about how we're asking those questions. And we're saying sort of new cough or new or different worsening shortness of breath. Muscle aches that are different from your baseline, right? So a little bit later, but I just want to really reiterate that for folks that it can be tough to sort of distinguish between, was this that person's normal cough and their normal presentation versus what may be considered symptoms of COVID.
So we're going to go through a bit of a progression here. So we're going to start with us as colleagues. So what happens if I'm sick? What am I doing when I first get to work? And then we're going to move into how to screen clients, then what to do kind of if an overdose happens, what to do when you get home, that kind of thing. So we are going to follow a bit of a progression in the presentation. So what happens if you or I are sick? So as of March 25th, Albertans are legally required under the public health order to self-isolate. So for 14 days if they have recently returned from international travel or have had a close contact of someone with COVID-19. This next guideline has changed in the past couple weeks. So it went from 14 days to 10 days if they have had COVID-19 symptoms that is not related to a pre-existing illness or health condition. So that is something really important to mention. So if you constantly like have a runny nose and a cough because it's spring and you're allergic to hay fever, that's a pre-existing illness that you should be mentioning to your workplace, just so that they are aware and aren't constantly wondering if you're spreading COVID.
So we will talk a little bit more about that self-isolation piece in this unique population. But I also want to just be clear about what that public health order does. It does not allow us to forcibly confine anybody. But the police under the Public Health Act could write them a ticket, which we all know how well and able our clients are to pay for tickets that they receive from the police. So
yeah. One of the best ways though to do your assessment is by using the COVID-19 self-assessment, and that is found just at myhealth.alberta.ca. And that self-assessment is being updated pretty much weekly with new information. So they are now asking if you live in Calgary. That is one of their questions for screening, whether or not you should self-isolate or not, just because a lot of the cases, the majority of the cases are in Calgary. So if you've taken it one day and then go to take it the next day and it's different, that's very normal right now because they are updating it with best practice. So just so you're aware.
And sometimes that, like when there are big changes coming out, that's being updated multiple times a day. Even.
Yeah.
So really, we are doing this at 10:19 today. By 10:25, this could be different by the end of this thing. So do kind of check in with that website often.
Sorry.
Haley pushed something wrong. Oh my gosh.
Do this one?
Do I want to do this one?
Sure.
No. Okay.
Okay.
So these are not new things. I'm hoping that this is not the first time that you've heard these things. There are big signboards on most roads talking about washing your hands frequently and thoroughly, using soap and water for at least 20 seconds. And so this is something that cannot be understated, that this is really, really one of your very best protective measures. It's better than wearing gloves continuously. Wash your hands thoroughly with soap and water for that minimum of 20 seconds. So pick a song that you like to sing and just sing it for the whole time. When you cough or sneeze, do it into a tissue or your elbow. So, really making sure you're covering any of those large droplets that will be spraying out. Throw that tissue, if you're using a tissue, immediately into the trash, and then wash your hands again for the 20 seconds. And because at that point, if you've coughed or sneezed into your hand or touched your face, we do recommend that washing with soap and water rather than hand sanitizer if possible. Again, just because we tend to be a little bit more thorough when we're washing our hands than when we're just hand sanitizing. But in a pinch and there's not a sink and soap available immediately. Hand sanitizer is the next best thing. Avoid touching your eyes, nose, or mouth with unwashed hands. Has anybody else really discovered how much they touch their face since all of this? Holy moly.
I'm just like,
I know. So like wear scarves and like touch your eyeballs with your scarf, and then don't also sneeze into your scarf. But really being cognizant of how often we touch our faces is pretty remarkable. Wear a mask if you have respiratory symptoms, if you're caring for patients, or are in areas where you can't practice social distancing. So really we should be wearing masks right now. But again, we have cohorted, so it doesn't matter. So I want to touch on wearing masks. If you are symptomatic, you wearing a mask. So I have a runny nose and a cough, say. I put on a mask. That is protecting people around me from what I have. If I have this cough and sore throat and Haley's wearing a mask and I'm not, Haley is not actually protected. So the person with the symptoms wearing the mask is what is most effective at preventing the spread. But we will talk about mask wearing a little bit. Is there anything you want to touch on?
And just to add on with mask wearing, as you're probably seeing, a lot of people are now wearing masks at the grocery store, just kind of out in public. So this was a recommendation that was made just a few days ago by Dr. Dina Hinshaw, just because there is a high risk of asymptomatic transmission with COVID-19.
We love her.
We do, yeah. She had mentioned, and just from the research that has been going around, a lot of people are technically like infected with the COVID-19 virus before they show symptoms. So that can be 2 days before, that could even be 4 days before. So that mask wearing in public is really to account for asymptomatic transmission of the virus. So basically spreading the virus prior to showing symptoms. So that is the reason why people are wearing it. It's not to protect themselves again from other people. It's to protect other people if they are asymptomatic of the virus and just haven't started showing symptoms yet.
So I have a question, Haley.
Yes.
Because you and I work in areas that maybe are higher risk scenarios and potentially could be infected and asymptomatic, would you consider wearing a mask to the grocery store?
I would, because I'm seeing hundreds and hundreds of people a day come in that have also seen hundreds of people a day living in close quarters with not great sleep patterns, not great nutrition, not immunocompromised, not great access to sanitary aspects, so hand washing, showers, all that good stuff. So for me, I am coming into contact with them all the time. So my risk for being an asymptomatic carrier is probably substantially higher than someone who has been off work for the past couple weeks and has only stayed in their house. Yeah. So I think it's a great idea. Personally, to be honest, I haven't been great at it.
I've been great at it
since. Have you been out to the grocery store yet?
No.
Okay.
So I've been so great. I've just stayed home, except when I go to work. But that's not true, because I did have to go to Walmart and buy chocolate, and I did wear a mask. So I think that that's something that is helpful to hear. Maybe you actually don't care at all about what we do in our lives, but I would, if I was going to the grocery store, I would, just for that risk of being that asymptomatic carrier. So avoid close contact with people who are sick, sneezing, or coughing. So the social distancing piece, staying well away from the sort of blast radius of somebody's cough or sneeze is really important. And so 6 feet, again, don't use us as your guides, because we are not following that rule right now. But staying away from people as best as possible. So I don't know if in your neighborhoods you see people walking and then they stop to chat. Well, they're at least 6 feet apart usually. So this is a really good thing. And so also wearing that mask in areas where you're not able to social distance. So in a grocery store, you may like come down an aisle and suddenly 10 people are coming at you. Again, this is a great opportunity. If you had a mask on, that would be an extra layer of protection.
And that's what that mask is in public, is it's that extra layer of protection. So if you are wearing a mask in public, that doesn't mean you don't have to wash your hands. That doesn't mean you shouldn't be social distancing. You should be practicing those two things first and adding a mask on.
Yeah.
As kind of a third layer of protection.
And also just a piece on masks. If you're not used to wearing a mask, you're actually more likely to be touching in your face and fiddling with that mask. So that can actually create, more opportunities to become infected. So just be really mindful of that. When that mask is on, it's something that's new. Really avoid touching it, avoid fiddling with it as best as you can, and absolutely wash those hands. When in doubt, just wash your hands.
When in doubt.
Clean and disinfect surfaces that people and objects that people are frequently touching. So the things that we think about often are those door handles, things like that. But in a work setting, think about the kettle, think about the microwave, think about the fridge where everybody's getting their lunch. And so while all we have control over is what we do. And so if I were to go open the fridge at work, I would do so either with a tissue or with a sanitizing wipe, and just wipe it down as I was doing that. And, if we're all doing those same kind of practices, we can trust each other, but really look out for yourself and therefore protect your coworkers.
And also there's a new information, which what we're calling a two-step approach. So this two-step approach is essentially wiping that surface twice. So the first time you're wiping it, you're actually wiping it to get rid of like dust and particles, because COVID-19, like Rachel said, is a very big virus. So it's kind of wiping to get any particles off. Your second wipe is to actually disinfect. So you're going to want to use two separate cloths. So if you're using Cavi wipes at work or Acel wipes or like 60% bleach, just make sure you're doing a two wipe system, and then letting it dry if possible.
Do we talk about spray cleaners here, Haley, or no?
No, but you go ahead.
Okay, so really important, if you are using spray cleaners in your place of work, that can actually aerosolize something. So you want to make sure if your cleaning solution comes in a bottle, that you're spraying it right into a towel and then wiping. If you just wipe it directly on that surface, whatever particles are there can become aerosolized. So just be really mindful of that. That's a bad picture because it's got that spray bottle.
It does. You're right.
Oh dear me.
Oh,
okay,
boy.
We'll change that.
I'll change the picture.
Stay home if you're not well. So I think one thing that might come out of this great pandemic that we are experiencing is that maybe people, when we are feeling sick, instead of sort of pushing through and, oh, it's just a little tickle and, I'm just really tired, maybe we'll take the time that we need to actually recover. So let's keep that in mind and carry that forward.
Oh, so we just had a question about what type of masks should I wear to the grocery store, work, etc. So the grocery store and work they'll probably actually vary. So if you're going to the grocery store, if you're out in public, you don't want to be using like a medical, surgical, or N95 mask.
People will be mad at you.
Yeah, because we want to save those for people who are working in the healthcare system right now, or working closely with clients who could have COVID-19. So the grocery store, there's you can make cloth masks, you can buy cloth masks. Rachel has a really nice one on right now.
I like it because I look like a ninja.
A ninja?
Yeah.
You can also just use like a scarf or a bandana, just anything basically to act as that third barrier to protect those droplets from spreading from your nose or mouth when you're going to the grocery store, out for a walk, or where you could be coming in contact with people within that 2 meters distance. If you are at work, that's going to base a little bit on your company's policies on what type of masks you're using. So for the most part, most people are using kind of those surgical or medical masks that people would use, say, in like an operating room. And it's doing the same thing. It's preventing those particles from myself. If I'm wearing one, it's preventing the particles from myself from going to other people. And then if we're looking at, say, aerosolizing aspects at work, so if you have to use oxygen for a respiratory compromised patient, or you have to respond to an OD and you have access to oxygen, or you're using face masks, you're going to want to use an N95 because those particles have now aerosolized. So it really just depends where you are.
And N95 masks, when we see them walking around in Walmart, I like to give people the benefit of the doubt and think that that's the mask that they had on hand and they haven't bought a stockpile of masks to hoard. But N95 masks have to be they have to be specifically fit to your face to be effective. And so that's why, again, you know, seeing them out in the grocery store, you're like, oh, I really wonder, is that person actually fitted for that mask? Or did they just, you know, buy these off the street and are wearing them and it's actually not going to protect them? So just be really mindful of that. But again, let's practice kindness in the grocery store.
Yeah,
and
kindness
I'm
everywhere
speaking
right
to
now.
myself really at this point, and stop judging those people wearing N95s when.
And I think to touch on what Rachel mentioned, it's really important right now because this virus is evolving every day. So understanding that everyone is doing the best they can with the information that they have. So there's a really great saying is you do your best until you know better, and then you do better, right? So we're all doing the best we can with the knowledge that we have. And we go from there, right? So now that we've talked a bit about kind of COVID-19 basics, we're going to talk about the realities that come with our clients in a time of an outbreak, just because of the inequities that they face. So their access to soap, clean water, and sanitizer could be very limited in comparison to what myself and Rachel and everyone watching has access to. Their ability to social distance in shelter settings. So that not just in shelter settings, but in organizations that they frequently visit. I know most organizations right now are doing the best they can to provide social distancing, whether that's like, even if you go to the grocery store, you know, there's one-way traffic now. There's little red feet kind of everywhere for where you should stand. There's a lineup outside the grocery stores. So organizations really are trying to do the best they can to aid in that social distancing. And shelters are as well. Like they are really trying.
Everybody is doing the very best that they can
with the resources that they have. Yeah. Access to testing services, maybe more limited as well. Access to timely messages and information. So they may not be getting the same information that we are getting today. So with all these constant updates, they might not have the same awareness that we have with the access to technology that we have. Health risks and immune function. So a lot of our clients are immunocompromised. They have comorbidities that we're dealing with. A lot of them are respiratory comorbidities, so that increases
COPD,
their risk substantially. And just access to basic needs, so adequate nutrition, sleep, everything that would keep our immune system substantially higher. And
you know, recognizing too that being able to isolate is a bit of a privilege, right? People that need to acquire their substances and the equipment to inject their substances or use their substances need to go out to get that. And so it really is a privilege to just be able to stay home and to, you know, have enough toilet paper and to have enough food there without having to go out and acquire that every day. So again, let's just recognize that.
Okay, so we've talked about COVID-19. We've talked about some of the problems some of our clients will face. So we're going to get into, you've now arrived at work. So you drove to work. What are you doing when you first get to work? So a lot of guidelines have changed within Alberta and BC and Saskatchewan and Manitoba, like Canada-wide in the past kind of week and a half. So now they are recommending that healthcare workers, if you are in the vicinity of providing direct patient care to clients and you can't maintain that 2 meters of distance, you should be putting on a medical mask at the start of your shift. So this medical mask doesn't need to be changed every single time you talk to a new client or approach a new client. This medical mask is to be changed when it's soiled or damp. So usually that 2 to 4 hour time period, or if you've come in contact with like aerosolizing particles or droplets,
like I sneezed right at Haley,
or
right
someone
now.
who's had symptoms. That is when you would want to change it. So goggles or a face mask. So
these do not count. PS. These are my eyeglasses. Haley's gonna grab her goggles, which are quite stylish, I might add. But if you wear eyeglasses to see, you actually also need to wear something over top of that. So whether that be goggles right over top of your glasses or a face shield, whatever you have access to, that's what you need to do.
Cool.
Goggles and face shields can be reused.
Yeah. So they're my hipster goggles, but they go all the way back, which is nice. So they have kind of a shield that goes kind of a little bit back to my ear, so it protects me from particles on either side. And then dead on. To be honest, you can You can get goggles right now at Canadian Tire. You can get like a pack of 25 for $25. You can get more like stylish ones on Amazon.
They might deliver in like May of next
You know
year.
what? Mine, they said they would deliver like May 16th and I got them the next day. So who knows?
I think Haley
You
should
never know.
share what brand these are because they are pretty
Mhm.
cool, you guys.
They are
Magico.
Magico. Anyhow, they're anti-fog. They're fantastic. This isn't an ad, but they're great.
we should have asked permission if we were allowed to say that. We do not promote any.
We're not promoting anything. No.
Except they are cool.
Yeah.
Sorry, go on.
And then gloves. You should be wearing gloves if you can. And they're just changed after every interaction with a client, so hands-on care. But like we mentioned before, hand washing is going to be your number one protective factor with this virus. So if you don't have access to gloves, make sure you're washing your hands a lot.
Yeah. And some people think like, oh, well, if gloves are going to protect me from when I touch a patient, it must be best to wear them all the time. That's not actually true. What happens is whatever may be left on your hands after you wash them and put your gloves on, or even when you reached into that glove box, there may have been some germs on that glove box that you've now sort of put onto your hand. And then your hands are in your gloves and they're sweating and it's a warm, moist environment. Bad things happen in warm, moist environments. So really, your skin is your best protection. Wash it frequently. Make sure that you know, the integrity of your skin is good, so they're not dry to the point of cracking and bleeding, because that is, you know, a portal of entry for things. So washing your hands, moisturizing them often, but don't wear gloves constantly.
No, and make sure you're performing hand hygiene before you put on your mask and goggles, just so that if your hands are dirty and then you're up in your face, there's a lot of mucous membranes up there that a virus could potentially.
Most of your mucous membranes are on your face. And so just really, if your hands are going towards there, make sure that they're clean.
One thing that I do want to, when you're arriving at work, there's something that's really, really great, really easy, that really isn't face or hands. It's your footwear. So if you can have a specific set of shoes right now that you are only wearing to work, you're not wearing those shoes out to the grocery store, potentially not wearing them home either. Pick a pair of shoes. Those are now your work shoes. Keep them there. Wipe them down at the end of every shift,
and burn them after the pandemic.
Burn them after the pandemic.
Yeah. We should plan for that. A great big bonfire.
Shoe burning. It's gonna stink really bad. Okay, so you're at work. You've got your PPE on. You're feeling really good. Now clients are starting to come in. So what are you doing when clients are first coming in? So we do want to do an initial screening when clients are coming in. So that screening aspect is very important. And this is where we're going to talk about kind of what's the difference between maybe a dope sick runny nose and a COVID runny nose. What's the difference between a smoker's cough and a COVID cough? So knowing kind of those differences and your baseline with your clients. But you want to be asking, do you have a fever or a new cough or any kind of difficulty breathing there? If yes, you're going to get them to clean their hands. They should be cleaning their hands when they come in to site anyways. Put on a mask and then make sure you're telling someone about it. So if you guys have like communication log or management or whatever policies that you are using to report either ILI symptoms or
influenza-like illness for those of us who are not nurses,
or COVID-19 symptoms, because they're very similar. Make sure there is a process for reporting within your site.
Does anybody have any questions about these symptoms specifically?
One thing that I have found with even just like kind of like a tip is if you can screen people right at the door of your agency, it prevents that transmission throughout your whole site. So if you're letting them through kind of one vestibule or one area of your site and then you're screening, well, anything that they've come in contact with, if they are symptomatic, or any person they've come in contact with, we're now risking that spread of infection. So the sooner you can do that screening and get a mask and clean the hands of someone who's potentially a carrier for COVID-19, is the best way we can reduce the spread of this infection.
And so one thing I've noticed is that people maybe think that if they say yes to any of those symptoms, that we're going to deny them access to service, which I think we have to be really clear when we're asking these questions, that, you know, we're not saying like, if you have a cough or a sore throat, that does not mean that you cannot access our services. It just means that we're going to be a little bit more mindful to try to get you the best care that we can, and to make sure that you know, if you are unwell, that we can take care of you in the best way possible. So if you can communicate that, you know, because, you know, we start asking, do you have a cough? And people are like, no, 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 no. And keeping in mind that, you know, we may not be the first person, likely are not the first person to ask them at this day, on that particular day. Likely they've accessed other services already. So they may have had their temperature checked at least once that day already, and we're doing it again. So just how we have those conversations with folks, and just to, you know, to reiterate, like, I know you probably had this done 4 times already today, but we're going to do it again because things can kind of prop up. And we just want to make sure that everyone is well. You are well, and the other clients that we're working with are well.
So just out of curiosity, which if anyone wants to type it in the chat box, how many people within their agencies are screening, doing a temperature check when their clients come into their site?
That's not real, is it?
Okay, so yeah, from what we're kind of seeing, yeah, so someone wrote Rachel wrote my name of my goggles that are on our chat, but that's great. So that there are lots of agencies that are doing temperature checks right when people come in to the site, which is really important. Okay, so a lot of the adult shelters, not sure about the family shelters. Okay.
My understanding is that a lot of the family shelters are actually, they've sort of split up into not one big family shelter setting, but really more scattered site. But if anybody is on here that can clarify that, that would be greatly appreciated.
Perfect. Yeah, so if you are taking a temperature, anything over 38, we're wanting to be reporting it. So Rachel, so a client comes in and we're asking, hey, do you have a new fever? Do you have a new cough? Do you have a runny nose? And they're like, well, I always have a runny nose when I'm dope sick. And I just smoked a cigarette outside, so I have a cough. Are you going to mask them?
No.
No?
Do they have a fever? Have I checked their temperature?
Yes.
I've checked their temperature.
They don't have a fever.
I will ask them to clarify on that cough. Is this a different or new cough for you? Is it a productive cough? Are you coughing anything up? But I mean, if they're obviously hacking, I would actually probably put them in a mask, because that's going to be comforting to other people who are seeing that person cough. So yeah, I might actually.
Yeah, I probably would too, just because I feel like at the beginning of the pandemic, there was a lot of stigma surrounding people wearing masks. And there's also a lot of stigma around people who are even just coughing in public. Like, you go to the grocery store and someone does and I swear, like 10 people turn around and look at them and they get this stink eye, right? Like it's not a great situation for anyone.
I saw a funny thing. Can I share it?
Yes.
It used to be that people would cough to cover a fart in public, and now people fart to cover a cough in public.
Where did you see that? Just a meme?
My mom told me.
Oh, okay. Is your mom on this chat?
She is on this chat.
Sweet. Yeah. Hi, Mom.
Hi.
Great meme. Yeah, so I would ask them to wear it, just simply to try to reduce this stigma that we're seeing with people wearing masks. And I know I've had a lot of clients who we've asked someone to wear a mask and they're like, I don't really want to. And there's like 10 clients behind them. They're like, give me a mask. I'll wear one, just to try to normalize it, which is really great in that aspect. But to me, if there's any chance of droplet transmission, I'm going to stick them in a mask.
Yeah. And I think being overly cautious initially is in everybody's best interest. So, you know, if they say like, yeah, I have a bit of a cough, if they're totally hacking, like, let's get them in a mask and this requires further investigation. This requires more questions. This definitely requires, you know, checking their temperature and asking about history and all of that stuff. But in that immediate time frame, throw a mask on them so that you can really do a thorough investigation and keep everybody safe. And the thing is often, you know, I think we kind of go to like, well, clients aren't going to be compliant with this. They don't want to do that. But they are very agreeable. They are just as concerned about this as all of us, right? They don't want to be sick unnecessarily, and more so than they already are, right?
Yeah.
So they want to protect themselves and they want to protect their peers as well. So let's give them the benefit of the doubt and be able to take some ownership on their own health. And I think they're really quite happy to do that for the most part.
Yeah, and someone did ask, what happens if a client refuses to get their temperature checked? And I think at first, you know, that's going to start with a conversation. So why we are checking their temperature in the first place. So it's not just for their safety, it's for the safety of their peers, it's for the safety of the colleagues that are working at that site. It's for the functionality of that organization, because, you know, like a lot of our clients who access different services, they really value the services that they're accessing. And if for some reason all the staff got sick and that service wasn't available to them, that can make a big difference in their quality of life and just their day-to-day routine. So I think it's really important to have that conversation with them as to why we are screening. And I understand that for clients, because policies and procedures have constantly been changing for them, that sometimes every time they come in, it's going to be a new routine. And for a lot of clients that we work with, our vulnerable populations, they like that consistent aspect. They like going into a site knowing exactly what to expect, because that might be their only consistent factor that they have that day, is going and be like, oh, this is normal to me. This is what I can always expect, and it doesn't change. And right now that just isn't the case for pretty much any organization. These policies and procedures are constantly being adapted. So letting clients know that and be like, you know, like, this is what we're doing this week. It might be completely different next week based on research that has come out. And the reason why we're adapting and changing these policies and procedures is for the best interest of the community, yourself included. So having that conversation, I do know some organizations, if they are refusing to get their temperature checked, they are denied access to the service. That could be, I know that's the case for some organizations. I'm not sure how it is for shelters. I'm not sure if you can speak to some of the shelters, if you know. But if anyone wants to comment, if they're aware in the shelter setting, if they are just being denied access, or if they're immediately having to put on a mask, which that might be your better option, is, you know, if you're not willing to get your temperature checked, then we do need to put you in a mask just preemptively.
Yeah.
So there could be conversations surrounding that so that they don't get denied service.
And I think the way we approach this always, right, using that harm reduction lens, a sense of humor goes a long way, you know, to be like, I know this is different than yesterday, like, silly us, we're just trying to keep on top of this. But really reiterating that, you know, we really are doing these things to protect clients and to protect ourselves and our staff. And so how we approach that, right? If we're approaching it in a like, you need to do this or you do not get access, it's a, hey, you know what? I really want to let you in. I really want to have you access our services today. How can we make that happen?
For sure. Okay.
Chatting too much. I
don't know, maybe. We're very chatty people. We apologize. So COVID screening. So you get a positive COVID screening. What are you doing next? So hand wash them hands, put a mask on a client. You're going to call to have a client swabbed. So there's a few different places you can call, or organizations that you can call to get a COVID swab for a vulnerable population client. So you can call CCT. SafeWorks Outreach is doing community swabs. Do you know any other places?
They are doing them in the shelters through community health agencies like CUPS and the Alex, at shelters. I think so. Put a mask on that client. Make sure you have a mask on as well. Try to isolate that client in some area, and most shelters, I think, at this point have an isolation space where they can send people for further assessment. So that initial primary assessment is happening at the door with those questions, right? And we check their temperature. All of a sudden we realize, oh my goodness, they do have a fever. that's when we will, make sure that person's in a mask, and then they're going to go to a space for a secondary screening. And usually that's either the nurse on site or a call into one of those agencies. And each shelter has a different process, has a different doctor on call. So know your agency's plan for that. But make sure that they're in that isolation. We don't want to send people back out whenever possible, because at least if we have them and they're contained, we know where those symptoms are going, right? Just imagine somebody who has to do all the contact tracing for this. If we can minimize their workload by isolating them immediately upon finding that person or that positive case, that's going to be your best bet. And then get the screening in. So you're going to call your doc on call, you're going to call CCT, whatever your process is, to get that person swabbed. Now, what do we do if this person has been swabbed? We don't have the results right away. Where does that person isolate? So there's a couple of options. Many of the shelters do have little isolation spaces where people can stay if that's appropriate. If they are symptomatic, and so let's imagine it's you or I and we had symptoms. If we're able to stay at home with those symptoms, that's the best case scenario. So either if that means isolating in the shelter or isolating in the isolation hotel that exists now, then that's the best place for them. If those symptoms, so you or I, again, we become sick and we can't manage our symptoms at home anymore and we need a little bit more help, then that person should be in a hospital. And so again, follow your agency's process on this. But I think that kind of covers that.
Yeah. Okay. So we've screened ourselves. We've screened our clients. We're at work safe. A lot of our clients are using drugs. So drug use in a pandemic, and then we're going to get into a bit of overdose response. So there's a few things we can encourage our clients to do to be safe or safer in a pandemic. So minimize sharing supplies. So this just isn't like needles or pipes or hoses. This is like cigarettes and joints now. Anything that would come in contact with a mucous membrane, we are not wanting to,
like even water, right?
Yeah,
bottles of water.
Nothing.
Like if we can provide that sort of thing so people don't have to share, that is the best case scenario.
For sure. So if your clients are say they're using like a meth pipe or a crack pipe, and they're like, you know what, like we only have one between us, we cannot not share. Make sure they have separate hoses. So the hoses, I'm not sure if anyone knows, but they're just little attachments. They're about this long. They just attach to the pipe, just so that basically it's to prevent like HIV and hepatitis C transmission generally, because the pipe heats up and can cause cracked lips and then blood exposure, but it will help prevent, if you're changing out that hose, it will help prevent or mitigate some of these COVID-19 transmission aspects.
And many programs now are handing out new inhalation supplies, so smoking supplies like the pipes and the bills, hoses as Haley was calling them. So you can get those at through SafeWorks for sure. So if your shelter happens to be a site that is a satellite site for SafeWorks, they are distributing all of those, and they're doing a great job of making sure that we can get more of those out so that people don't have to share. So that's really great.
Yeah. And again, if they can minimize contact, fantastic. Get them to prepare their drugs themselves. So, and if they absolutely can't, get them to make sure to watch that person who's preparing their drugs. So make sure they've washed their hands, their equipment is clean, that type of thing. So just so that you're taking those extra precautions, plan and prepare for an overdose. So EMS services may potentially be backed up just because of COVID-19. So making sure clients have naloxone, know how to use it, and are familiar with that process. One of the things with naloxone though right now is we want to stick with injectable naloxone. We don't really want to be using the nasal spray, just because that comes in contact with a mucous membrane, and when you pull it out, there's a potential to be exposed to that virus.
Again, though, if that's what your agency has, use what you have.
Yeah. Make sure you're stocked up on supplies. Prepare for a potential drug shortage. So right now we are seeing a change in substances in Calgary. So methamphetamine, cocaine is very, very, very expensive. So people have been switching substances to like Adderall or Vyvanse or Dexedrine, so other stimulants that they might not be used to, even though they are safer. They might not be necessarily used to them as well. Fentanyl, we are seeing a lot of benzodiazepines in fentanyl right now. So just understanding that aspect, which we'll talk about when we're talking about overdose response as well. And then if you can, get them to stock up on their drugs and medications in case there is a drug shortage.
Or in case there's some kind of like mandatory quarantine,
Yeah,
right?
for sure.
Like if they can't leave their homes, do they have enough medications, or do they have a plan for, you know, getting a safe supply of medications if they are quarantined and can't leave?
Yes. Okay, so opioid overdose identification. So I'm sure all of you are very familiar with this, but what we're looking for an overdose identification with an opioid is slower erratic breathing, that cyanosis, so the bluing of lips, blue fingernails, kind of that pale, clammy skin, snoring or gurgling, loss of consciousness or altered mental status, slow heart rate, clammy skin, limp and unresponsive. They could have some uncoordinated muscle movements or muscle rigidity. This is just kind of a friendly reminder with what an opioid overdose identification looks like, just so that we can get into how to respond to an overdose in the presence of COVID-19. So if someone is having an overdose, you want to make sure you have on your PPE, so your personal protective equipment. So donning is just a fancy word for how to put on your PPE. So you want to make sure you are performing hand hygiene before you put anything on. So if you do have access to like a gown or like a clothing cover, put that on. If you don't, just make sure you're not wearing the clothes out in public that you were wearing at work. Then you're going to want to put on a face mask. So if you're not using any kind of oxygen, the face mask that you have on from work is sufficient. Goggles, and then gloves. Do you have anything to add?
Nope. There are lovely posters of this and the sequencing of donning personal protective equipment online at ahs.ca.
Yeah.
And so we really encourage people to print those out and just kind of plaster them wherever, like wherever people are likely to don their PPEs. Another great option, which some of the shelters may be doing, is wherever their overdose equipment is normally kept, they keep the PPE right in the same space. So something to consider so that people are not having to run around. One thing is that sort of risk assessment, right before you respond to any overdose. Typically before this global pandemic, we may have just sort of run right in and started reacting right away. What we're doing now is just asking people to take a step back, slow down a little bit, do that risk assessment, and take the time to protect yourself before you're running in there. So making sure that personal protective equipment is on before you do that.
So a person has an overdose. What is this? How are we responding? So like Rachel said, we want to make sure we're keeping everyone safe. So clients, staff, co-clients, everyone. So because we are not doing a lot of airway management right now, just due to respiratory and airborne precautions, you want to make sure you are calling 911. So making sure you're calling 911 to get the services to that client that they need, and then giving Narcan. So this is potentially could be very different from what your agency was used to doing. If you were providing rescue breaths right away, a lot of chest compressions, a lot of agencies aren't doing that anymore, just because that causes aerosolizing particles. However, if you are doing rescue breaths, or if you're doing it on the street, make sure you're using that face shield that is in the Narcan kits. They haven't really shown that it's 100% effective, but they haven't been able to show that it's not effective. So any kind of barrier is better. And that one doesn't cause a suction just because it's a sheet that just goes over the face. So there's not a risk for aerosolizing. As of yet, there's not a risk for aerosolizing.
So there's no risk of aerosolizing, but there is obviously very close contact, right? Yeah. And so these recommendations really are coming from your agency. So making sure that you're consistent with your agency policies. and where we might have, you know, initially gone in to do those chest compressions or that rescue breathing, now we really are just going immediately to Narcan and 911. And it may feel like we are not doing enough for the clients that we know and love. But we want to just reassure people that if this is an opiate overdose, Narcan is usually quite effective for this. 911 is still responding in good time. And we can't do anything if there are no staff to take care of these patients, right? So we really want to make sure that we're taking care of ourselves, and we do that by keeping ourselves well.
And also, just to add on to what Rachel said, is it's a two-way street. So we're also looking at what the client could potentially give to us as colleagues, but we also need to be looking at what we could potentially give to the client. So if we're looking at our clients, and a lot of them are very immunocompromised with respiratory illnesses, if we are potentially an asymptomatic carrier, if we are giving rescue breaths, we could be giving that infection to a client and making this substantially worse for them.
Yeah.
Because if we're looking at COVID-19, it's a respiratory infection. When we're looking at, say, fentanyl or any other opiates, those affect the respiratory system. So anyone who potentially has COVID-19 and is using a CNS depressant, so fentanyl or hydromorph, your risk of overdose could be substantially higher because your respiratory system is already compromised with an infection. So that is something to take into consideration. And if we're also looking at with what kind of drugs we're seeing on the street in regards to fentanyl, with there being a lot of benzodiazepines in the fentanyl right now, we need to make sure we are calling 911, because Narcan may not be as effective with the benzodiazepines as it's not as effective with benzodiazepines as it is with an opioid. So you might not get the same response as you would if it was just fentanyl, like it was kind of 6 months ago.
Mm-hmm. And some agencies are actually considering, if it's an unwitnessed overdose, so you don't see the person go down, 2 doses right off the bat of Narcan.
And that's been
that's pretty standard.
That's pretty standard, and that's actually been some agencies' policies before COVID-19. If you didn't see a person, if it was an unwitnessed opiate overdose, like lots of places were giving those 2 doses right off the hop anyways, just because you're not sure. So biggest thing, make sure you're calling 911. When in doubt, give Narcan. I know a lot of agencies kind of before COVID-19, it was like, well, if we don't have to give it, we won't. We'll be very sparse with it and give oxygen if need be. And now, to be honest, the safest way to protect yourself and your clients is to give that Narcan.
And so on that note of protecting clients, one of the best things, because maybe it feels like what you normally would have done would be chest compressions and breathing, and so now you're not doing enough. Something really, really effective to protect yourself and other clients is to get other clients out of that space, because when EMS is responding, they may be doing chest compressions and oxygen. So you want people out of that space before they do those things that could potentially aerosolize that virus. So get people out, clear the environment, clear the room. Once that person has been responded to by 911 with chest compressions and or oxygen, then you want to decontaminate that whole area.
Yeah. Yes. So if EMS does come in and uses oxygen, and like high flow oxygen, so above 6 liters, or a big valve mask or a non-rebreather, anything with like high flow oxygen or humidified oxygen, you want to make sure that that area is clear for about an hour, and you've been able to disinfect it fully, just because since those particles have now aerosolized, we need to give them time to settle before we can clean. And that would be standard kind of across Canada right now. If you don't have what we call an HVAC system in your agencies. So if you have an HVAC system worked into your agency, that's going to be based on your policy developed within the organization for how fast that HVAC turns over and how many times an hour fresh oxygen and air is circulating within your site. This is just a overdose response that was based off of Towards the Heart. So we did get some of our information off of here for the presentation. This is based out of BC, but they have been updating it on pretty much weekly with new standards. So
they're an excellent resource.
They are an excellent resource if
sure.
anyone is interested in looking kind of more with aerosolizing oxygen components, but
which are not really going to apply for shelter
for a lot
settings
of people
at this point,
unless
so
EMS is coming in
yeah,
and using aerosolizing procedures.
And keep in mind, EMS is going to be wearing N95 masks, which most of us will not be in the shelter. And so if they are doing those things, you also need to clear out of that room.
Okay, so you've responded to an overdose. Now, how do you take off your equipment so that you're not contaminating
yourself,
your family, your colleagues, and other clients? So first thing, you want to take off your gloves.
We should have brought gloves so we can show you.
Yeah.
You want to...
I have gloves.
Oh, Haley has gloves. I'm sure this is not something new to you guys. You probably take off gloves all the time, but trying to maintain, keeping in mind that the outside of your gloves is what's dirty. And so peeling them sort of from the cuff, rolling them inside out, and then finger inside the other one to roll that out so you're not contaminating your hands. And then immediately wash your hands. So you've taken your gloves off, which Haley will kindly demonstrate.
Okay. See? One thumb in, kind of rolls into a ball, thumb under so that you're not touching outside garbage. Hand wash. Then you're going to take off your gown or your whatever sort of, maybe it's a lab coat, maybe it's an extra t-shirt or whatever. Take that off. Again, by rolling it inside out and disposing of it appropriately, either in laundry or garbage. Wash your hands. Yep.
Then you're going to remove your goggles because you just have clean hands now.
You have clean hands.
You're going to your face. You're going to take them from the sides
down, and we'll show you how to wash them as well.
And make sure you're putting them on a surface that that is easily wipeable. And then you're going to wash your hands again because there might have been something on those goggles. So you're gonna wash or sanitize your hands again.
This is why cream is very important.
Yeah. Then you're gonna take off your mask. So usually the masks either have the ties or the elastic. Grab them kind of by the elastic. Make sure you're pulling it away from your face and immediately into the garbage.
Yes. And also, while we're talking about doffing, so that's just the fancy term for removal of PPE. When we're doing question and answer segments on Fridays. So if anyone is wanting like a full PPE doffing example, let us know. We'll grab PPE and we'll show you how to do it.
There is actually on ahs.ca, there's a really great video and they go really nice and slow. And it is really a good example of that. So ahs.ca, just look at doffing video and you'll find it.
Perfect. Okay, so we've taken off our protective equipment, but when we're talking about changing, cleaning, disposing of PPE,
should we wash our hands again, Haley, after we took off our mask?
We should.
Yes.
We definitely should. Yeah. Good catch. If we're talking about a gown or kind of a lab coat, whatever you're using to kind of cover up your clothing, you're going to remove after each client care. So that's like an aerosolizing aspect. If your gown gets soiled, wet, or damaged, you just want to take it off, remove it, dispose of it so that it can be cleaned. Or if it's a single use, then it just goes in the garbage. Your face mask or goggles should be, since it's used throughout the shift, it can be cleaned at the end of shift, or if you've left the vicinity. So say you on your break, you went out for a smoke, you're going to want to clean them because you're not going to be wearing them probably when you go out for a smoke. So you just want to make sure you're cleaning them when you're taking them off or if you're leaving the vicinity. So if we're looking at goggles, if you're cleaning them, so it kind of depends. Some people use Cavi wipes on them. Some people use Excel wipes. You can also just use soap and water. But if you're starting to clean them, you actually want to clean them from the inside out. So you want to start on the inside and then work your way out to the outside, wash, dry, and then you can disinfect it. So you're going to want to use that two-step approach as well. So cleaning off particles, dry, and then disinfect.
A good rule of thumb is to sort of clean from the least dirty part. So least dirty to dirty each time.
Yes. Gloves, changing after client care, overdose response, direct care of symptomatic individuals. These are single use. So you just chuck them. You don't have to worry about washing them, anything like that. Masks, you're going to change your mask if it's visibly soiled, wet, or damaged, or after kind of that 4-hour time frame. Change your mask if you're leaving your
Site.
like your site, or change it if you've come in contact with a symptomatic individual. A good rule of thumb when we're looking at kind of PPE to help save PPE, if there are multiple levels in your organization, so there's multiple floors, if you can stay kind of in one area when you're at work, sometimes that is not possible. We understand that there's different dynamics to every organization, but if it's possible to stay kind of on one floor,
that'll limit the change of the PPE between areas.
Yeah,
for sure. And we do want to be mindful, right? These are sort of resources that are not finite at this point, and so we do want to be really mindful about how we can be thoughtful in how we use them. And so clustering activities is another really great way. If you're kind of going into an isolation space, make sure you have everything prepared that you're going to need before you go in there, so you don't have to leave and go get something and then don and doff and do this whole process again. So just really, I think what we're asking people to be very mindful in taking that risk assessment every single time, and to slow down in our work and really make sure that we are doing things in a way that is protecting ourselves, our clients, and our resources that may be finite, such as masks, gloves, and personal protective equipment. So try to minimize the times we have to change and throw them away.
We've gone to work, we've been safe. Now what happens when we are leaving work? So any clothing that you wore at work, consider it dirty. So whether or not you want to bring a clean set of clothes and change into it at work, basically put all your clothes in the laundry kind of as soon as you get home. If you don't have access to like laundry all at once, just stick your clothing in a garbage bag until like laundry is available, so that your clothing isn't kind of touching and contaminating anything within your household. Wash your hands before leaving work and as soon as you get home. If you're taking public transit or if you're driving your car, any of those contaminants you can be bringing home to your family. Disinfect your phone, your keys, your ID badge. Wipe off your shoes before you leave work. So give them, if you have Cavi wipes or Excel wipes, or if you're using like water with 60% bleach or whatever your organization is using for cleaning, just give them a wipe on the bottom and tops of your shoes. And then if you can, stick them in a bag and change into separate shoes to go home. Have a shower and wash your hair when you get home. So if you are not wearing like a head covering or any kind of surgical scrub caps, make sure you're giving your hair a wash when you get home, and your body, just to get rid of any potential particles that could be on your body.
If any of us were fancy before this and washed before work, like showered before work, you can stop that. I think pandemic has given us all permission to not shower before we go to work now.
You shower after
work. If there's any good that has come of this, it's sleep in a little bit longer, put a headband on because you went to bed with wet hair and it's crazy. Throw a headband on and go to work, and then have a shower when you come home.
Hair salons are going to be really bumping after this because everyone's dyed hair is going to be gone.
We've gone over time.
Shocker. I know. I'm just going to jump through. We're going to do some scenario questions with our question and answer on Friday. Just an FYI to everyone right now is Alberta pharmacists kind of authorized the issue to prescription renewals and emergency refills, but also to support access, Health Canada has issued kind of the following exemption for prescriptions with controlled substances. So pharmacists can extend prescriptions, they can transfer prescriptions to other pharmacists, that type of thing. But also there's been new information kind of effective April 1st with opioid agonist therapy. So 120 days from April 1st, for individuals who don't have healthcare coverage, they can access OAT, so whether that's Suboxone or Methadone, for free for 120 days. just to mitigate withdrawal and emergency room or healthcare service need.
And minimize the amount of time people have to go out
For sure.
to
Yeah.
acquire
drugs
drugs,
and all that good stuff. These are just some infographics that we at Westside have created. So if any of your organizations are wanting just some simple infographics for your agencies, feel free, shoot us an email. We can send these your way. So we have safe outreach during a coronavirus outbreak. So kind of personal safety tips, how to keep everyone safe. And then we do have just an FAQ for shelter and drop-in settings as well. So frequently asked questions for staff. If anyone is wanting those, just feel free, shoot us an email, shoot us a message here, whichever we can send them your way to your agencies.
Should we go to questions or should we do the scenario things?
Let's do this Friday. We're like,
Yeah.
we're like 40 minutes over time.
40, yes, we are. Oh my God.
Anyhow, so question and answers. If you have any questions now, feel free. We can kind of spend 10 minutes answering them, but we're going to do a question answer segment on Friday. So if any questions have come up or you have questions now that we just didn't get time to answer, feel free, shoot them just to this email address or send them here. We can save the chat and either answer them now or answer them later.
So that email address, for those who may not be looking at the screen and doing other work, is info@westsideharmreduction.com.
Yes. And either myself, Rachel, or Corey, probably myself or Rachel because Corey is swamped in BC,